California. Ms. Walters for 5 minutes.
Thank you, Mr. Chairman. Sadly, like so many other communities, Orange County, which is where I live, has been ravaged by the opioid epidemic. In August, the Orange County Health Care Agency issued its 2017 Opioid Overdose and Death in Orange County report. I have it right here. And Mr. Chairman, I would like to submit this article for the record.
Without objection.
This report found that the rate of opioid-related emergency room visits increased by over 140% since 2005. Drug overdose deaths between 2000 and 2015 have increased by 88%, and nearly half of those deaths were due to accidental prescription drug overdose. Orange County officials and health providers are working hard to combat this epidemic, but sadly, some bad actors are doing far more harm than good. And I want to be clear that not all rehab centers are taking advantage of patients. It's the bad actors in this space that require us to hold this hearing. A 4-part series published in May 2017 by the Orange County Register exposed the practice of patient brokering and insurance fraud. And Mr. Chairman, I'd also like to submit this article for the record, please.
Without objection.
It found that a lack of oversight of rehab centers contributed to these practices. One issue is that there are nearly 2,000 rehab centers throughout the state, yet only 16 inspectors are employed to monitor the centers. According to state regulators, between 2013 and 2016, consumer complaints about licensed rehab centers nearly doubled to 509 complaints per year. Bad actors in the rehab center business are exploiting this epidemic through deceptive advertising and third-party recruiters to persuade addicts from around the country to travel to Southern California for treatment. In fact, some rehab centers will pay for an individual to travel to California and then sign them up for insurance. Some recruiters will seek out those suffering from the addiction at AA or NA meetings or drug courts to find people to send to rehab centers who will then pay the recruiters a kickback. These bad actors run up medical bills for patients, yet do little to provide effective treatment and recovery services. Court documents and state records found that some centers, including sober living homes, provide street drugs to patients to restart the fraudulent process. I'm incredibly troubled by these practices, particularly given how rampant it is throughout my district and state. Mr. Nielsen, my questions are for you. It is our understanding that in California, the Department of Health Care Services licenses residential or inpatient treatment facilities, but does not license outpatient treatment facilities. Do you know why that is?
That's a great question, Congresswoman Walters. And I asked myself the same question as well. They should license or certify outpatient facilities. They do not. And I think it's just something that's been passed through time, that originally it was voluntary and to have an outpatient facility. And we don't even have a licensure for drug and alcohol counselors to do private practice. So actually anybody can hang up a shingle and do private practice in California. So I think that there needs to be licensure for drug and alcohol counselors in private practice, as well as that the outpatient facilities need to be either licensed or certified and make it mandatory.
Do you know if there are outpatient facilities licensed or overseen by any other body to ensure that these facilities meet standards to ensure safe and effective treatments?
So part of our network, we have a provider network, and there are many of them that do adhere to our standards and are a part of, but they usually are not the ones that are part of the problem. Also, one of the issues is that the out-of-network providers versus in-network providers. We're finding in California that it's the out-of-network insurance providers that are the largest issue, and not so much the in-network providers.
Okay, interesting. Okay, you state that sober living homes serve as a bridge to independent living. This stage of the recovery process is obviously distinct from inpatient treatment, yet clearly the patient is not prepared to resume complete independence. Should these sober living homes be subject to state licensing?
I think they should be certified, and I think that Riverside County is a really good model to what it should look statewide. They actually protect the ADA and also make sure that there's actually proper oversight of those facilities. And there also has to be a mandatory complaint line for neighbors and individuals to complain, and somebody needs to be able to investigate those. And I think part of that, I don't necessarily need to be a part of the state, but it could be independent oversight by a nonprofit that would take on that responsibility.
Okay, thank you, and I'm out of time.
Thank you.
Thank you very much.
Gentlelady yields